I thank the chair. In the district I represent, Greater Lawrence Family Health Center proudly operates a teaching health center. In fact, it was the first teaching health center established under HRSA's Teaching Health Centers GME program more than a decade ago. Since then, hundreds of residents have graduated from their program, including 11 this year. And as we speak, another 32 residents are currently training in their 4-year curriculum that exposes family medicine specialists to an array of medical needs in one of the most diverse communities in Massachusetts. The success we've seen at Greater Lawrence Family Health Center is far from an outlier. In fact, during the past academic year, THC GME program supported nearly 1,000 residents at 72 community health centers across the country. And as Congressman Ruiz mentioned, many of those physicians will go on to serve traditionally underserved communities that their health centers cater to. A HRSA Commission study found that 82% of teaching health center GME residents will go on to practice in the specialties they trained in, and over half will practice in medically underserved areas. That means that with each passing academic year, we're adding more and more trained physicians in communities that desperately need primary care specialists, something that's more important than ever as we face critical workforce shortages across the healthcare industry. Recently, Lowell Community Health Center, the health center based in my hometown, received a grant to plan and develop a new teaching health center primary care residency training program in family medicine. This is particularly exciting for those of us who have seen the tremendous results down the road in Lawrence and want to replicate that in Lowell. However, while HRSA awarded more than 90 planning and development grants over the past 3 years, there are challenges for health centers to achieve THC status. That's why I'm particularly pleased that our bill today would reauthorize this program for 6 years, the longest period this committee has ever reauthorized it, and would permit greater certainty for medical students. This will allow for community health centers like Lowell to have greater clarity and certainty that they will be able to build up their THC program beyond the planning and development stage. I thank my colleagues on the committee for their support for this program, and I look forward to working with them to make this funding permanent to provide even greater assurance for THC programs across the country. Madam Chair, I'd also like to underscore the importance of ensuring health centers aren't left hanging out to dry if there's a funding cliff later this year. Community health centers in Massachusetts alone serve more than 1 million patients each year, and the grant funding we're moving through committee today is critical to their operations. We must ensure that there is not a loss of funding, which would be devastating as we continue to improve access to health care for all communities. And finally, as this committee continues this important work of lowering health care costs for hardworking families, promoting price transparency, and encouraging competition among providers, it's imperative that we keep in mind the essential hospitals across our nation who have been on the front lines for the past 3 years, helping us navigate extremely challenging times. Many safety net hospitals continue to struggle financially today, and we have a duty to ensure these hospitals can keep their doors open and continue delivering the best care possible in the communities they serve. That's why I'm working with some members on our committee to draft and pass a federal definition of essential hospitals to set the basis for more appropriate reimbursement for these facilities. I'm eager to partner with my colleagues on both sides of the aisle on this important issue. I thank the chair once again, and I yield back the balance of my time.